On proper use of medications, today we're going to be addressing a major issue in the use of drugs. Now, people have contemplated on how to swallow their medications, and some people prefer to use food while some people prefer not to take food. Some people like to swallow their own in hot bar or joint, and sometimes most people think that you cannot take medications on empty stomach, or you can eat before taking medications. That is not actually right. So today I'm going to be addressing this in the most feasible way. Okay, I would say that in the use of medication, the most vital person or the most important person that can advise you on how to use your medication is your pharmacist. That's why whenever you are taking a drug, they ask you or probably on the paper they will ask you to consult your physician, or they ask you to consult your pharmacist. Why is this important? Because different drugs has different ways that the absorptions are made faster. We have drugs that are hydrophilic and others that are hydrophobic. Now let's take as a case studies. There are some medications that you need to take food, or you need to take with meat to reduce their adverse effect on your stomach. Medications like NSAID, your non-steroid anti-inflammatory drugs like your diclofenac, your ibuprofen, and the rest. Also your antacid. These are medications that you need to take with meals to reduce the adverse effect or to reduce your risk of having ulcer. But thereafter, there are other drugs that you should take on empty stomach to make sure that they are absorbed properly well. For example, the drug for ulcer, the omeprazole that you use for ulcer. These are drugs that you need to take on empty stomach so that the drugs will be absorbed properly. More also, there are some drugs that you cannot take with milk or anything that contains milk. Now this is because milk will reduce the absorption of these medications, and you know that the major content of milk is calcium, right? Now this can also alter with the calcium level in your body. Now this medication includes some antibiotics, your thyroid medications, and medications to treat HIV and the rest. So having idea of this will also actually help you to know what to take. Now there is another type of medications. Now let's talk about your medications for diabetes. For example, glibenclamide. The use of glibenclamide is preferred to be taken 30 minutes before meal. Now this is to reduce the effect of hypoglycemia. Hypoglycemia means it can reduce your sugar level beyond normal, which is even more dangerous than diabetes. So it is preferred you take it 30 minutes before meal. But why another medication which is used to treat diabetes, metformin, is preferred to be taken with meals is because diabetes can cause side effects in your stomach. Then also your common malaria drugs, your artemisinin based combination, artemether lumefantrine. Now the lumefantrine itself is not a hydrophilic drug, which means it is hydrophobic, meaning it's not absorbed in a water solution. It's not water soluble. It requires a lipophilic medium, which means taking fatty food along with artemisinin based anti-malaria drugs will help the drugs to absorb faster, and which will increase its bioavailability. To round it up, there's no specific way or a generalized way of taking medications, either with food, without food, with water, with milk, with fatty food, or determining the best food to use. Each medication that you are taking has the best way that you are supposed to take it, whether it's lipophilic, hydrophilic, or if it's going to affect your stomach, affect your stomach lining or cause you ulcer. So before you take any medications, you need to consult with your pharmacist. Your pharmacist is the one that will tell you the best way to take your medications, because you will keep on abusing drugs or using drugs the wrong way if you start doing self-prescriptions and self-medications. Make sure you consult your pharmacist before any drugs that you are taking, because they are the ones that will ensure proper use of medication. Remain your one and only Dr. Best. Don't forget to follow me on all platforms, and make sure you follow Medication TV. See you in my next video. Love you. Bye bye.